Hi, I'm Scott Mueller of Mueller Memorial, and I'm going to answer a question that I get asked a lot in my profession, and that is, why do we embalm and how do we do it? So I'm here in our preparation room, and this is our embalming bay. Our embalming machine is over here. The instruments and chemicals are in the cabinets behind me, and the table is right in front of me where the body would be placed. So let me tell you the reason why we embalm. First of all, we embalm for three different reasons. We embalm for presentation and preservation and sanitation. So number one, when a body dies, the body starts to decompose right away. And that can happen very quickly depending on the environmental conditions of where the death took place. Embalming doesn't stop that from happening, but it dramatically slows it down. Now, when people ask me how long does embalming last, I can't tell you. I can always say that it lasts long enough, because what we're really trying to accomplish is to preserve that body during the time that we need for that funeral service to take place. So that's preservation. Presentation is important to us too, because when a person dies, our blood flow stops. When the blood flow stops, a lot of the fullness to the face goes away because there's blood volume that takes up some of that fullness there. When that goes away, we actually restore that with the volume of the embalming fluid that we do to replace the blood. In addition to that, when somebody dies, all the muscle tension goes away as well. So our eyes relax, and our normal relaxed presence for our eyes is open, same with our mouth. And so this muscular activity is gone, and so embalming does help to make the presentation better. And then the last thing is the sanitation. It is important that I'm licensed by the Department of Health to protect the public health, because when a person dies, that decomposition can take over very quickly, and a funeral director knows how to manage that very, very well. So that sanitation element is very, very important, especially if that body is going to be present with other live people during the time of the visitation or the funeral service. So that person is cleaned, disinfected as part of the embalming process. Those are the reasons why we do it. Okay, let's talk about how we do it. I'll use myself as an example. An incision is made about this long, about 2-3 inches. And for most times, it's made right along the collarbone up here, which is usually hidden by a shirt collar or by a dress. And it's a small incision about 2 to 3 inches long. Underneath that, we reach underneath this muscle that reaches from the ear to the center of the neck. And underneath that muscle is going to be the carotid artery and the jugular vein. Those are major vessels. We like to go into that area because even on an older person, that artery generally is not sclerotic, which means that it's hardened over time. Many times in the lower vessels in the leg, those will be sclerotic, but up here that remains pretty resilient during that time. Into the artery, we inject the fluid. So there's a large bore needle that is put into the artery, and we inject this fluid, and it comes from this machine right here. Now this machine holds about 3 gallons of fluid, into which we put about a bottle or 2 of this embalming fluid. This is very heavily formaldehyde based, and formaldehyde is an excellent preservative. Sometimes, depending on the situation of the death, we add a modifier to it too, so that we get better dispersion of that fluid when it's injected into the body. Now, we're a closed system, thank God we are, because otherwise we'd leave a trail of blood every place. But whatever we inject into the artery comes out the vein. So that jugular vein then is snipped, and there's a little holder that goes inside of that to keep that open, and we're able to have the blood as the fluid is pumped into the artery, it makes around and comes back out that vein. Now, in the course of about 45 minutes of injection and some manipulation, sometimes there's some massaging that goes on to make sure that it gets perfused into the tissues. About 45 minutes later, the body is generally embalmed, pretty well embalmed. And we can tell that by looking at not only the texture of the skin, but we can look at the color of it as well, because when somebody dies, color goes away. Part of that is because of the presence of the blood. So when that's replaced, we can replace it with colorants that are already in the chemical, as you can see from this color right here. Once that's done, then we usually aspirate the contents of the gut, the stomach, the large and small intestine, and then put additional strong embalming fluid. This doesn't have any colorant because it doesn't need it, and we put that in there as well to make sure that that is well preserved. Once that's done and cleanup is done, then the embalming is complete. Now it sounds very simple, and most times it is a pretty simple process. It gets more complicated depending on the way somebody died, any trauma to the body, whether there was an autopsy or a post-mortem done after the death, or if there was a delay between the time of death and the time that we received the body, because that delay can cause some decomposition, which we have to treat differently. Basically, that's really the embalming process, as simply as I can put it. After this process, then, at some point the body will be dressed and we'll apply cosmetic to the face to restore the colorant of the skin. It is not to try and make somebody look alive. That's not our goal. It is to try and bridge that difference between the death and the life. Makes it a little easier for people to see. So after the dressing, the cosmetics, then the body is lowered into the casket. We have a lift around the corner from here in our preparation area, and that body is lowered into the casket, and the casket is brought into our room for the funeral services. After that, all is complete, and it's a pretty simple process. But I thought it was important because I get asked this question all the time: how do we do it? That's it.